Hi everyone, this is Shanice with Medicare Mentor, and today we're going to be discussing the key moving parts of Medicare. Now, outlined today, we're going to be going over how to get your Medicare, how much it costs, what it covers, what it doesn't cover, and your Medicare supplement policy. Now, with Medicare, there are four main moving parts. There's Part A, Part B, Part C, which is also known as Advantage policy, and finally, Part D. Now, one of the main questions that a lot of people ask me is, how do I sign up for my Part A and my Part B? Well, if you're currently drawing on Social Security benefits right now, all you have to do is wait for your cards in the mail. Because you're drawing on Social Security benefits at this moment, you'll automatically be enrolled in Part A and Part B, and your cards will be delivered to you at least 3 months prior to your 65th birthday. For some of you, a little bit sooner than that. Now, for the rest of us that are not drawing Social Security benefits at this moment, there are predominantly three main ways that you can sign up for your Part B physically. The first way is by going down to your local Social Security office and signing up with a representative there. Your second way is you can give Social Security a call at 800-772-1213, and they'll sign you up right over the phone. The third and most common way of signing up for your Part A and Part B is at their website at ssa.gov, which is your Social Security Administration.gov website. That's the quickest way to sign up and most effective, and it's super easy to sign up online. Now that you know how to sign up for your Medicare Part A and B, another common question a lot of people ask is, how much is it going to cost me? Well, with your Part A, that's also known as your premium-free Part A coverage as well. And the reason why it's free is because as long as you've worked for 40 quarters or 10 years, same thing, all right, it's already been paid with all the taxes that were coming out of your check each month. So that's why your Part A is completely free for you. Now, for individuals who did not satisfy that 40 work quarter, or they'll at least work 10 years, you do have the option of buying your Part A. Now, with Part B, there is a monthly premium involved with it. As of 2017, the Part B premium is going to be $134 per month. Now, if you're drawing Social Security benefits, no worries. That's going to automatically come out of your Social Security benefits check each month to take care of your Part B premium. Now, for the rest of us who decided to delay our benefits, not a problem. You can pay that Part B premium on a monthly basis to Social Security. Okay, next common question that a lot of us ask is, when can I sign up for my Part A and my Part B? Well, typically, you sign up for your Part A and your Part B during something called your initial enrollment period. Well, when's that? Your initial enrollment period is specific to your birth date. So it's going to be 3 months before your 65th birth date, your birth month, and then 3 months after your 65th birth date, totaling 7 months you have to sign up in your Part A and Part B. Keep in mind, don't delay and wait till the last minute to sign up in your Part A and Part B, because sometimes there may be delays at Social Security when first enrolling in your Part A and your Part B. Now, when enrolling in Part A and Part B, I want to stress even more not to wait to the last minute, because if you don't sign up in time, you can be assessed a 10% penalty for each 12-month period you go without Part B coverage or any type of credible coverage. Now, after you signed up for your Part A and Part B, most people like to ask, okay, well, what does it cover? Well, to answer your question there, we're going to be referencing your 2017 Medicare and You booklet. Which you can follow along here with me on the screen. Now, I'm going to have it here on the screen with me, and you guys can just follow along. All right, when you jump here to page 15, okay, you're going to see that it has a nice quick outline of what your Part A and your Part B covers for you. Now, your Part A, okay, which is for hospital. That's what your Part A is going to cover for you. Now, underneath Part A, it's going to cover things like inpatient care in the hospital, skilled nursing care, hospice, and home health care. Okay, as you come down here a little bit more, you have your Medicare Part B, okay, which is your medical portion. Now, Medicare Part B are going to cover things like when you go to the doctor, outpatient care, durable medical equipment, and most importantly, your preventative services. Now, as you can see, Part A and Part B covers quite a lot, but there are some things that Part A and Part B do not cover. Now, when we scroll down a little bit further here, and we go over to page 61, it's going to give us a list of what's not covered by your Part A and your Part B. Things that are not covered by your Part A and Part B are things like dental care, eye exams, dentures, cosmetic surgery, ear exams, and exams for fitting your hearing aids, acupuncture, and long-term care. Now, keep in mind, because Medicare doesn't cover services like that, you could still get them as a separate plan. It's best that you talk with a licensed Medicare specialist in order to assist you with that and to see which one would be the best option for you. Now, next step here, when we jump back over to page 15, okay, you have something called Medicare Part C. Now, with Medicare Part C, okay, which is also known as your Advantage Plan. All right. Now, an Advantage Plan is a managed care plan where you have to leave original Medicare, go into a private-based plan, and you receive these services through a closed network like HMO or a PPO plan. And this is an alternative to having original Medicare. Now, keep in mind, we will be going into a little bit more detail as to what a Medicare Advantage plan is and how you'll be able to get one of those later on in the next video. Now, the last part here that we have is your Part D with Medicare. What is your Part D? Well, your Part D is D for drugs. We'll keep it simple. All right. So anytime you need to go fill any prescriptions or anything of that nature will be handled by your Part B. Okay. Now, you know what your Part A does, and you know what your Part B does, and you know what your Part D and C does as well. Well, a very good question that a lot of you ask is, how much does it cost to actually use these plans? Is there a cost involved? Is there deductibles? Well, yes, there are. Now, to go into a little bit more detail as to what those costs are, we're going to be using something called your outline of coverage. Now, your outline of coverage is something that you get with your Medicare supplement policy when you choose one. This one here I'm going to be using as an example here today. All right, I'm not going to say the specific company because these Medicare supplement policies are standardized. Well, what does that mean? Well, here, if you go over to page 81 in your Medicare and You 2017 booklet, okay, where it says Medigap policies are standardized, meaning that every Medigap policy must follow federal and state laws designed to protect you, and they must be clearly identified as Medicare supplement insurance. Okay, so what that means is that whether you get a Medicare supplement policy from Company A, or you get a Medicare policy from Company Z or Company J, they all have to work the same exact way, regardless of which company you go with or which plan you go with, because they're all standardized. Now, back to the outline of coverage. You wanted to know, okay, are there any costs involved when I do actually use my Medicare? Well, when we go to the summary of benefits here, okay, we're going to go to the Part A first to see what costs are involved. Now, what I want you here to focus on is what Medicare is going to pay and what you're going to pay as well, and what you're responsible for. Now, here, Part A, which is for your hospital, you do have a deductible that you are responsible for. And that deductible amount is $1,316 for the first 60 days. Now, for days 61 through 90, okay, you're going to have a copayment cost of $329 per day. Days 91 and after, you will have a copayment cost of $658 per day. Now, that amount can add up to a lot after a while. When you actually factor in all those costs, if you were to stay like half a year or close to 9 months in a hospital for a few days, or accumulated that many days in the hospital, you could be looking at spending almost $10,000 alone just for your hospital stay. That doesn't include surgery or drugs administered there or specialist doctors that you see while you're in that hospital. This is just for your hospital stay alone. As you scroll down here, you see the skilled nursing care facility as well, which is also covered under your Part A. Okay, you do have a copayment cost of $164.50 a day for days 21 through 100. Keep in mind that the first 20 days will be covered by your Medicare Part A. Now, as we scroll down here in our outline of coverage, okay, what are some of the costs involved with Part B, you may ask? Well, with Part B, you do have a deductible as well. Your Part B deductible is going to be $183. Okay, once your $183 deductible has been met, Medicare would swoop in, pay 80% of that bill for you, and then the 20% that's left over, that'll be your responsibility. Now, I noticed here that you've been looking at some of the numbers that are adding up with your Medicare, with your $1,300 deductible with Part A, your $183 deductible with Part B, and that 20% gap that's left on your head. Now, what you need in this case is something called a Medicare supplement policy. That is what's going to come in and put a cap on all these costs that are arising when it comes to Medicare. So that $10,000 or that $1,300 will be covered by a Medicare supplement policy. So it would give you the peace of mind that you need when going into the hospital and you're using your Part A and your Part B for the first time. Now, in the next video, we will go into more detail as the difference between a supplemental policy and an advantage policy. That way you can make an educated decision as to what's the best route for you. All right, this is Shanice with Medicare Mentor again. Hey, if you feel like I went too fast or there was something that you missed, not a problem. Just go ahead and rewind the video and go back to the spot that you feel like you need to go over it a little bit. Now, if you feel like you need someone more personalized and you have more questions that weren't answered here today in the video, just give us a ring here at Medicare Mentor at 855-344-8733, and any one of us here would be more than happy to help you with any questions that you may have. All right, keep in mind, for more information about supplemental policies, just go ahead and click on to the next video and we'll go into a little bit more detail. Bye, everybody.